Good morning. We're doing part 2 of doctor shaming. And I'm glad that we had a few days in between part 1 and part 2 because I had a lot of really interesting and really good comments over the weekend about part 1 of the show. One viewer defended doctors, and rightly so, because I want to make sure you all know that I'm not saying that all doctors out there are bad people or bad doctors. There are really, really good doctors out there that take their oath, first do no harm, seriously. But see, harm comes in all different shapes and sizes. And that's what we're going to talk about today. Something else occurred in between part 1 and today's show. And there was a news story on Nightly News, which a viewer, Deborah, brought to my attention. And I actually had already seen it. But thanks, Deborah, for the heads up, too. About a pharmaceutical company that has stopped giving what I call scripts for perks, or perks for scripts. A few years ago on 60 Minutes, they did a show where they interviewed several doctors who said that basically pharmaceutical companies have given them free lunch every day for a month. Pharmaceutical companies have sent them and their wives on expensive cruises. And this is true. This is true. What farm companies do is they will say to a doctor, well, the more you prescribe this new drug we want to promote and, of course, make money on, we will give you perks for every prescription you write. Kind of like selling Girl Scout cookies. Except it's opioids that they're giving perks for. Kind of like your doctor has a tag board in his office. Well, I need to get to this, to 200 scripts, and then my wife and I get to go on a cruise to Mexico. It's kind of scary if you think about it. You know, he's up to like $199, and I walk in and I have some minor ankle pain. Ooh, you have pain? Let me write you a script for Oxycontin. That'll make you feel better. Yeah, we're going to Mexico. I mean, come on. We already know that the opioid epidemic is out of control in this country. And we also know, as I've said on previous shows, that opioids give your body the same sensation as heroin. I mean, are we going to go down to the corner and talk to the local heroin dealer and say, wow, you've got 2,000 customers. We're going to send you and your girlfriend to Mexico. Good job. Opioids are legalized heroin, prescription heroin. Otherwise, the opioid addicts would not turn to heroin when they can no longer score their scripts. They don't turn to crack. They don't turn to marijuana. They go right for the heroin, because it gives them the same high. And it's a problem. It is a problem. If you interview for a job as a salesperson for a pharmaceutical company, they will say to you, do you golf? No. Well, you better learn. Many doctors are taken on expensive golf outings by pharmaceutical reps. They get to play golf for free. They get to go to the clubhouse and have steak and lobster and free drinks. And then they get the pitch. We have this new painkiller. We really want you to use it. And these reps, these sales reps, they're not doctors. Remember this too. You are not the pharmaceutical company's customer. The doctor is. Your doctor is their customer. You are your doctor's customer. You're a customer. They call us patients, but we're customers. We are paying for a service. And just like we don't want to go to Lowe's and buy a microwave that's going to explode in our kitchen and possibly kill us or burn our house down, we don't want to go to the doctor and be prescribed a product that could kill us because he and his wife want to go to Mexico next year. That's not cool. You are your doctor's customer. And I'm proud that at least some pharmaceutical companies have stopped doing these perks. Again, it's not Girl Scout cookies. it's prescription, dangerous, addictive, and possibly life-threatening drugs. Speaking of being a customer, waiting rooms. Don't y'all love the waiting room? Don't you love it when there's a big sign at the reception area that says if you cancel your appointment, if you don't show up for your appointment, you don't cancel within 24 hours, we're going to charge you anyway. You have to pay us. Ever get paid because your doctor didn't show up for your appointment on time? We all know that many doctors do not practice evening hours or weekend hours. Many of you out there take off work to go to a doctor appointment, whether it be an ill visit or your annual pap smear or a mammogram. You take time off of work. And for some people, that means you're not getting paid because you're not at your desk. And you schedule first appointment of the day. I want a 7:30 appointment, and 8 o'clock comes around and you're still sitting in the waiting room. What do? Well, I'll tell you what I would do, because I always schedule first appointment of the day. And I used to go to this eye doctor because I chose him because I could walk. I don't drive. He was close to my house. He had good reviews. But many people don't review the wait time. I always asked for first appointment of the day, which was 9 o'clock. And I was always there at 8:57. I'm never late. And I'd be sitting in the waiting room. 9 o'clock came. 9:10 came. 9:15 came. And then I see him walk in the back door. He was late. He didn't show up to the office knowing he had a 9 o'clock appointment. Now that happened once, and I thought, okay, I'll try him again. Then it happened again, and the last time, 3 strikes you're out, I was sitting in the waiting room with a 9 o'clock appointment. At 9:15, he walks in, and it had been a snowy, icy night. And instead of seeing me, who had been sitting there for 20 minutes, he takes a bag of ice melt and starts throwing it on the sidewalk leading into his office, the back door. I'm like, wait a second, don't you have staff that can do that? I'm sitting here paying you. I'm not getting paid to sit here and waste my time and twiddle my thumbs and look at the clock ticking. You're already 15 minutes late for my appointment, and you're going to go throw ice melt out on your sidewalk. That was it. I no longer go to that doctor. That was infuriating. And it's disrespectful. It is disrespectful when they don't honor the appointment. They have the responsibility. If they're running behind, if you have a 1 o'clock appointment, because you think, oh, I'll go to my appointment over lunch. If they can't meet the appointment, they have the responsibility to call you and tell you, the doctor's running about 10, 15 minutes behind today. That's their responsibility. Because when you're sitting in that waiting room, you're wasting your time, and especially at this time of the year. Because you go to a family doctor, even for a well visit, a pap smear, a physical, you're going to be sitting in the waiting room with people who have the flu, who are sick. And the longer you sit there, the more chance there is they're going to give you whatever they have, because they're there for an ill visit. You could walk into a doctor's office for a pap smear or an annual physical and walk out with a deadly flu. We all know the flu vaccine isn't working this year. Lots of people are dying. So it is disrespectful. I give you this. If you wait 15 minutes, you go up to the reception and say, you know what? I'm not here because I'm sick. You have not honored my appointment. I'm leaving now. You call me and let me know when the doctor will actually be able to see me at my convenience, because it should be at my convenience. After all, I'm the one paying the doctors and their staff's salary. Being rude to patients. Being rude to a patient is the worst thing I think that can ever happen. And sometimes it's not the doctor that's the problem, it's their staff. I wrote a blog a few years back where I was on Depo-Provera, birth control. And because I spend 6 months of my year down at the Bay, or 5 months, I got my shot at the Bay, at a doctor's office other than my family doctor. And when I came back and I was due for my shot, I sadly didn't keep the receipt that I had had my shot. But I told them I had my shot. And this nurse, because the nurse always gives you the shot, she refused to give me my birth control shot. She didn't believe that I had had my shot in Maryland. And I said, you know what? Bitch, don't even play, because I don't want to get pregnant. And so we talked to the doctor. The doctor ordered her to give me the shot. Well, she walked into that room. She threw the medicine on the table. She said, I could lose my license for this. She takes the thing off the needle, pointing the needle at me. I could lose my license for this. And I'm like, I don't know what the hell. I said, all I'm going to tell you is you give me this shot, because if you don't give me the shot and I get pregnant and I have to have an abortion, then you're going to lose your damn license. I wish I had had a tape recording, because I would have actually taken her license. I should have reported her. You don't treat a patient like that. You don't call a patient a liar. Why would someone like me, who has never missed a birth control shot in her life, who is so adamant about not getting pregnant, why would I risk that by skipping a shot? Again, you got to listen to the patient. And that's our next one. Listening and hearing a patient. I've told you all many times that for many, 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 many decades, I was telling doctors I never wanted children. I wanted my tubes tied. Oh, no, you don't. You're going to change your mind. You haven't had children. You're young. You'll change your mind. What? Do you have some kind of crystal ball? You don't even really know me. I'm telling you, I never want children. And I've got a really good story for you. It was a letter to the editor in our local newspaper about a couple that went into the hospital to deliver their 4th child. She was 32 years old. And she said to the doctor, and this is the easiest time to get your tubes tied, is right after you've delivered a baby. You say, I don't want any more kids, tie my tubes. Usually it goes off like clockwork. This doctor was like, no, you're only 32 years old. You can have more children. They already have 4. Her husband, God bless him, said to the doctor, this is my phone. You tie my wife's tubes right now, or this is my phone calling a lawyer. And then I'm calling the press. Doctor tied her tubes. I was told for 30 years that I was going to have a child one day, that I would change my mind. But I was also told, if you don't want kids, let your husband get a vasectomy. Now, again, my husband can get a vasectomy, but I can't get my tubes tied because the doctor thinks I'm going to want kids. With my husband, who I'm married to till death do us part, gets a vasectomy, I'm not having kids. So how does that make any sense? And why is it, by the way, that a man at any age, I know 25-year-old men who just walked into a urologist's office and said, I want a vasectomy, and they had a vasectomy, no questions asked. Isn't it interesting that health insurance will pay for a woman to get her tubes tied now after the Affordable Care Act was passed in 2014? But they will not pay, no health insurance, very few health insurance will pay for a man to pay $900 for a vasectomy, which is, first of all, less invasive. It's an office visit, no anesthesia required. But they'll pay $18 grand for a woman to have her tubes tied. And I submit this, perhaps because it is so hard to get a doctor to agree to tie a woman's tubes that insurance companies know they're never going to really have to pay for that many. And let's think about this going with the conspiracy theory and the pharmaceutical perks for scripts. If a gynecologist ties my tubes, guess what he doesn't get to do anymore? He doesn't get to prescribe me birth control from the pharmaceutical company. Once he ties my tubes, I'm done. So no more cruises to Mexico for prescribing the pill or prescribing Depo-Provera. No more perks. The pharmaceutical companies get more money the more someone like me is refused permanent sterilization. That's the truth. It's the math. What I have spent on birth control, my God, you would be shocked. Probably well over $50,000 in 30 years on birth control. Probably should have just saved up the 18 grand and paid for the tubal ligation myself, or going to Puerto Rico where they do it on demand. They don't ask questions. You don't want to have kids. They say, okay, you don't want to have kids. That's fine. Some doctors will actually let a patient live with cancer in their reproductive organs. Well, we'll freeze these. We want to make sure that we don't do anything to mess up your fertility, because we know you're going to want children someday. You're a woman. Every woman's going to want to have a baby, right? They don't hear you. They don't hear you. But they sure hear men. Like I said, any man, no questions asked. I want a vasectomy. They don't even say anything. They just say, sure, no problem. Give me the money. There you go. You're sterile. It's very frustrating. Doctors all, of course, are human beings. They have their own personal beliefs. But I submit to you that a good doctor, a really, really good doctor, must leave their personal opinions and beliefs at the door and listen to their patients. Every patient is different. No patient should be treated like every other patient. You know, one of my doctors might have had a woman who changed her mind after she was sterilized, and that kind of spooked him. But again, you have to listen to the patient. 41 years old, I have abnormal cells in my cervix, and they don't want to remove my cervix. They want to put me through all kinds of Band-Aid procedures to make sure that I can still have babies. And all those times, every year, saying the same thing. I never want to get pregnant. I never want to get pregnant. My husband's not going to have a vasectomy. How many times do I have to say it? I explained to the doctor or the nurse practitioner at Planned Parenthood that we have had a lot of malpractice in our family. Doctors making mistakes, some leading to death, that we don't trust a vasectomy. We're afraid that my husband could have bad side effects. We all know that that happens. There are millions of hysterectomies done every day. Millions of hernia operations done every day. My mother died because of her hernia operation. We're going to talk about that later in the week. That's going to be Thursday's show. When a doctor or multiple doctors, because I've said it to, I'd say maybe 8 doctors I talked to and begged to be sterilized. And they're always like, no, you're too young. You're going to have a baby one day. You're going to change your mind. Well, I never did change my mind. I don't have children. I am now in menopause, safely in menopause. It's my safe place. But let's talk about menopause for a few seconds real quick. When a woman says to a doctor, I want a full hysterectomy, he says, well, yeah, we're going to do a hysterectomy. And then when she wakes up, he says, well, I left an ovary. One of my viewers had this happen to them, and she said, why did you leave an ovary? I told you I wanted a complete hysterectomy. Well, you're only 41 years old. I didn't want you to go through early menopause. Shouldn't you have asked the patient that question first? You know what? A couple years later, this same viewer had to go back and have that ovary removed because she got cysts on it and it was causing her pain. So instead of one surgery, one anesthesia, we all know anesthesia is dangerous, she had to have two because a doctor made a decision against her wishes. She went to sleep saying, I want a complete hysterectomy, take everything out. And when she woke up, she still had an ovary. An ovary that could have gotten cancer. She was lucky. It was just bad cysts that were causing her problems. But she still had to go under the knife again, under anesthesia, again, taking all those risks. They don't listen. So my advice to all of you is find a doctor, even if it takes a few. Find a doctor who listens to you. Know your own body. Know what you will and will not do. And let the doctor know. And if they seem like they're not listening to you, like they have their own agenda of how they want to treat you, and they're ignoring you, then you find another doctor. And I'm going to leave you with this little funny ending. You know, I have actually been told by doctors when I say I never want kids, I really want my tubes tied. They're like, oh, Paula, you know what? You're going to change your mind. You're probably depressed today. Let me write you a script for Xanax. Okay, I get to go to Mexico next year. Shaking my head, Political Paula is out.